Tinnitus is a kind of a sound which some people experience hearing in their ears. It is like a buzzing sound or a whistling sound that they hear in their ears. This is commonly seen in one ear, but in some people it happens in both the ears also. They will experience that sound coming in their ears. Normally, when the environment is quiet, we do not feel that we are hearing anything in our ears. But these patients, they will, even when there is no sound outside, especially at night when there is no external sound, they will still continue to hear some kind of a buzzing or a whistling or a ringing sound in their ears. That will tell they will realize that this is not right and something is not right, and they will understand that this is tinnitus. This occurs commonly in the elderly people because they are not able to, as they age, they are not able to hear properly because of the degeneration of the hearing nerve. So there is a nerve which connects our ear to the brain. Our ears collect the sound from the external environment, and this nerve transmits that sound from the ear to the brain, and that is how we hear sounds. Now, when as we age, the nerve starts getting weaker and weaker, and over time, our hearing capability starts decreasing. When the external sounds we stop hearing properly, the sounds which are happening within our ear and our brain, we can experience that sound. So this is common in elderly people who cannot otherwise hear properly. Then there are some times when even people with normal hearing experience tinnitus, and that is when there is some kind of a conduction problem between the sound going from our ear to the brain. There's some kind of circulation issue in that pathway, and that is when you start hearing the sound. When you experience the sound, you should go to a ENT doctor, get yourself thoroughly checked up. Then there are some tests which we do to understand how much is the hearing in the patient. If the patient's hearing is not normal and their nerves are getting affected, then you can there are some medicines which help you, and they help to uh, the the problem in the pathway which is there between the ear and the brain. They will help to clear that pathway, and then the tinnitus sound goes away. In case the medicines do not help, then there are certain other methods, such as you can wear a hearing aid which will cancel those noises. Then there is some other therapy called as tinnitus retraining therapy, which also helps to the patient cope with the tinnitus. Over the years, we are putting a lot of load on our ears. The younger children are using headphones, earphones all the time. They are listening to loud music long periods of time. So one way to prevent tinnitus is to make sure that you're not exposed to loud noises for long periods of time. And take care of our ears. Don't put headphones. Maybe you can use it for half an hour in a day at a low volume, not more than that. If you do it, then not immediately, but over a period of time, you will start experiencing a hearing loss, and with that, the tinnitus.